Hello everybody, I am Dr. Altamash Sheikh, endocrinologist from Mumbai. Today we will learn about COVID-19 and diabetes. COVID-19 is the coronavirus, what everybody understands. So what a diabetes patient needs to do? First of all, in diabetes, the way we say lifestyle modification is important. Similarly, for COVID-19 and diabetes also, we need lifestyle modification. The first thing in that is to calm down. Let us not panic about it. It is just another pandemic and we all can work as a team and we will be able to curb this particular infection also. So what can we do? First is eat on time, eat healthy food, eat cooked food completely, have soups, preferably hot warm soups which will keep you warm. You may have to keep some warm protective clothing also. Drink fluid water adequately. You may have lime water if it is adjustable by your body, because if glucose or diabetes is uncontrolled, it itself will cause dehydration, and when there is dehydration, it causes increased chances of the infection like COVID virus or COVID-19. Now, why is it that we are talking about diabetes? Because the risk increases, the severity of infection increases, the chances of getting other bacterial pneumonias also increases if diabetes is uncontrolled. Hence, all type 2 diabetes patients need to keep their glucose under control. If in case you develop any symptoms of COVID-19, you may need to even check extra monitoring of blood glucose and then adjust your sugars or glucose accordingly. Also, it is important to have a good sound sleep for at least 7 to 8 hours. We understand that there is a lot of anxiety, there is a lot of information from all sorts, but we need to calm down, especially for those who are more than 60 years and they have diabetes, heart disease, kidney disease, lung disease, cancer or other comorbidities. Coming to other part of diabetes like type 1 diabetes patients, they also need to monitor really frequently during this time of this pandemic. And also drink water adequately, hydrate yourself, check your ketones as advised by your doctor, and then take your medicines completely regularly. Have your stock completely fine and nice. For those who are on insulin pumps, be careful. If you are on paracetamol or acetaminophen type of tablet, the sweating might have caused some irritation towards the site of the pump, so please do check for that also. Now, important things what you should do in this COVID-19 and diabetes, we need something called as hygiene that needs to be practiced. So first I will talk to you about the hand hygiene. How do you wash hands for that 20 seconds? So first, when you take soap could be your soap bar or a liquid soap, you first just rub it over your palms, then open your fingers and rub it this way. With one hand the back of fingers and with the other hand the back of fingers. Then comes is your thumb that you would put soap, and then the other thumb. Take your tips of the fingers of both the hands, use this particular method, and then take tips of fingers to create or to put the soap in between the nails this way, and towards the end wash both the wrists. And if you do this, it takes automatically 20 seconds, and then wash both the hands in the free flowing water and that completes your hand hygiene. Second is the cough hygiene. How do you cough? So supposing if you have a tissue or an hanky, you could have taken it in your cover your mouth and take it down, but throw this particular tissue in a bin which is closed. If not, you can use the bent elbow like this to cough. Third thing, if you have sneezing, then you have to keep your elbow little more up to cover this completely, and this way you will prevent spreading the infection to other people. So this was cough hygiene. We need to avoid shaking hands, avoid giving hugs, avoid kisses, avoid fist bumps, avoid also giving an elbow bump to others. The best way to greet anybody in this kind of social distancing is to contain your hands within you. Either you greet with a namaste, you greet with your own one hand, or you bow down to people, so that we have a nice social distancing and avoid contaminating anybody else. So to get down with the information, look for important websites like government updates are there continuously. Your local area municipal and government authorities, look out for them. And most importantly, meditate and calm down. For meditation, you could do either breathing exercises, you could do yoga, you could watch a funny movie, because this is the time we need to really be at home, be with our loved ones. Maybe nature is trying to take its own time to heal this particular disease, but calm down, be at home, spend time with children, and especially if you have not taken any of the influenza vaccine or flu shot and you are high risk, talk to the doctor. In this moment, everybody is open to help. If you cannot reach the doctor, you can take an email consultation if required, and reach the hospital only if there are symptoms. For routine consultations, avoid going to any kind of hospital presently for few days, as we are seeing that there are restrictions on travel also. Many people have contacted us regarding the same, and this minimum information would help a lot of people. Thank you so much.